pink sheet. You can see.
Alrighty, so I have
Oh, look at that.
I have Pumba for you. He's a 2-year-old male intact Labradoodle. He's here for seizures. He had his first witnessed event on November 19th. They took him to his GP in Puerto Rico. They did some blood work. It was normal, so they just opted to monitor him. Had a second event on Christmas morning.
Hey, what you doing? Look.
What is it?
He's got a big nose. But in between episodes, he's completely normal.
Yeah,
Okay.
actually, when I bring him to the vet here, the emergency, he was completely normal.
Okay.
So, what you recommend to us?
So what a seizure is an abnormal burst of electrical activity. And there are kind of 3 things that can cause seizures. The first is something outside of the brain that affects the brain. Things like low blood sugar, liver problems, kidney problems. And we test for those with blood tests, which you've done twice now. So in essence, we've ruled out that first main cause of seizures. The second main cause of seizures is something physically wrong inside of the brain. We worry about things like inflammation of the brain, what we call encephalitis. We worry about malformations in the brain, tumors, strokes, things like that. And those are things that we can only see by doing an MRI, so by getting a picture of the brain. And then the third main cause of seizures is what we call idiopathic epilepsy. And that just means recurrent seizures that don't have a problem outside of the brain and don't have a structural problem inside of the brain as the cause. We classically see that between 1 and 5 years of age. They're usually normal between episodes. They usually have a normal exam. So a lot of things fit with Pumba of that being the cause. But the only way to know for sure that that's what the cause is by ruling the other things out. So we come to a diagnosis of epilepsy by ruling out things outside of the brain by doing blood work, as you've done, and by doing an MRI of the brain, which would be normal, and a spinal tap, which hopefully would be normal as well. So my recommendation for Pumba would be an MRI today to get a picture of his brain so that I can tell you, is this a physical problem in the brain like a tumor, stroke, malformation, inflammation, etc.? Or quite frankly, hopefully it's all normal, and if that's the case, then we diagnose him with epilepsy, which is much better for him to have than to have something like a brain tumor or something like that.
Look at these.
Let me get the
I don't know about you.
church right now and these.
Okay.
So Nugget is able to walk, but is weak and wobbly in his rear limbs. The left side's a little bit weaker than the right. Back seems a little uncomfortable, so it suggests a problem affecting the spinal cord of the mid-back of a mild to moderate severity, so he's able to walk relatively strongly. Possible causes: slip disc inflammation or meningitis, myelitis, a handful of other things. A little on the young side for a tumor, a little on the old side for some sort of congenital malformation. So infections possible, but this is disc versus meningitis until proven otherwise. We characterize spinal injury on a scale of 1 to 5, with 5 being the worst. A category 1 is when you're just painful, but you're walking completely normally. A 2 is what Nougat is today, where he's able to walk, but he's wobbly in his back legs.
And painful.
And painful, correct. A 3 is when you cannot walk, but you can still move your legs. There are kind of 2 main directions we can go. Direction number 1 is doing more tests. When I say more tests, I mean an MRI. And what that MRI would aim to do would be to tell me, is this a slipped disc, or is this meningitis, or is this one of those other things? Because a slipped disc is something that I've got really good chances of fixing with surgery, but many times it requires surgery. Sometimes it doesn't, but many times it does.
And the MRI will tell you if it does or doesn't?
An MRI will tell me, is it a slipped disc or not? And many times will tell me, is it a severe enough disc that surgery is in Nougat's best interest?
Let's do the test then.
Sure. No, I think that's the medically appropriate thing and what I'd be doing, you know, for my dog. We'll take good care of him, okay?
Thank you very much.
All right, we'll talk to you soon. Thank you so much.
Bye.
Bye-bye. So Ellie was diagnosed with discospondylitis on December 14th. She was non-ambulatory tetraplegic at that time. We had a couple things pending, so when we find discospondylitis, we're trying to answer, you know, what type of infection is it? Is it bacterial? Is it fungal? If it's bacterial, what bacteria is it, so that we can choose the appropriate antibiotic? Whereas if it's fungal, that's a little bit more worrisome. That was one of the worries, just because she's a German Shepherd. We do see Aspergillus a little more frequently in them. So we did fungal testing. That was all negative. We tested for brucella, because that's something that people can get. It's a zoonotic disease. Ruled that out. So sounds like we're improving on cephalexin. We will certainly continue that, because it sounds like we're improving. And Baytril. We'll probably start decreasing the medication, the pain medications. Looks like we ran out of tramadol a couple days ago, so that's perfect. Ellie looks great. Very, very happy with how she's doing. We kind of, you know, when it was her turn for me to examine her, we got her out of her cage, and she, you know, made a beeline to the back door, and I mean, just was walking better than I was expecting her to be. But about half the time, we don't actually find the name of the infection. But based off of response to treatment, at this point, it's more likely that it's bacterial, and it's bacterial that responds to these medications.
Right.
So the next thing is treatment. Usually it's long-term treatment, minimum of 8 weeks of antibiotics, but many times much longer than that. One of the factors I look at is her response. How is she doing? And she's obviously responded really, really well. The next thing that I like to use as a decision for how long am I going to treat is some sort of follow-up imaging.
Yeah, it's real big.
Okay. It's crazy how functional this dog is.
Yeah. And my other friend, my friend who was deep pain negative, and it's like a third of this level of compression.
We just finished Nougat's MRI. It's a very, very large slipped disc. So without a doubt, I would recommend surgery. So we will get started on that.
Do you still think it's going to be a 95% chance?
Yep.
Recover?
That is my expectation.
Okay, awesome. Thank you so much.
You're welcome. We'll talk to you soon.
Good?
Well done.
Pretty much?
Okay, let me sleep.
Yeah.
Doctor to be